nearly 6,000 women reach menopause every day in this country, and we're learning more about those who suffer more intense symptoms. Joining us on new treatments that are available is Dr. David Soper, Director for MUSC Women's Health. We're glad that you could join us. And yeah, 6,000 women every single day going through the change. Look out, right?
No, it's a growth industry. I mean, I think that if you look at your GYN practice, you'll be seeing a lot of patients with both perimenopausal and menopausal symptoms.
Yeah.
So it's important to recognize what those are, and it's important to understand that there's a solution to all of them.
Yes, and I definitely want to get into some of those solutions. You know, you reach a certain age. What now, with the way kind of hormones are behaving amongst our population, we're seeing girls reaching puberty much earlier than they ever used to. I think there's something to be said for maybe lifestyle, maybe forever chemicals. We don't quite know exactly, but that could potentially mean that the age in which we start entering perimenopause is also changing. So do you see sort of an average age that is shifted at all, or is it still kind of the 45 to 55 age range?
I warn my patients that when you hit the 40s that you're going to be at risk for menopausal symptoms. And I think the big challenge for the clinician is how to determine what is perimenopausal symptoms and what is a medical condition, because perimenopausal symptoms can include joint aches and pains, palpitations, and the typical sort of menopausal symptoms of hot flashes, night sweats, trouble sleeping, and the like. So I think that we just have to keep in mind that even though patients may not have had their final menstrual period, they still may be having perimenopausal symptoms.
Right. Now, I was going to ask you this question a little bit later on, but I'll just ask you now. Is there any way to stave off menopause? A friend wants to know.
I see. So I give presentations on this topic, and one of my slides says menopause is inevitable.
It is, yeah.
So there really isn't a way to stave off that occurrence. It's a reflection of just the loss of eggs in the ovary, which happens to all women at some time, at different ages, but all at some time. And that loss of eggs leads to a loss of estrogen, and therefore the symptoms associated with menopause.
And you could be that one anomaly that is 67 and finds herself pregnant. Very rare, but it has happened.
I don't know that, but
we've seen these items in the news. Do you not believe it?
I don't.
Okay, all right. So we can't stave off menopause, but how do we ease some of the symptoms? Some women, they suffer real terrible symptoms that are almost debilitating. So is there a way, are there new treatments available that women can take advantage of or learn about to make that journey a little bit easier?
Right. I mean, I think that everybody has a certain severity of symptoms that is very personal for them. But the big difference, I think, today is that we now recognize that hormone therapy is safe. There used to be an attribution to hormone therapy about breast cancer, about blood clots, and all of these safety concerns. But we know that by changing the way we administer the hormone, that we can avoid that. Okay. And that there really isn't an increased risk for breast cancer. We can, by giving estrogen transdermally, avoid the risk of blood clot. So patients who have not been candidates for therapy before are now candidates for hormone therapy.
Would you say that, depending on the level of symptoms, is hormone replacement for every woman? Should some write it out? Should others really consider, you know, this is the way to go?
I think the decision for hormone therapy is really very personal, and it should be discussed with your healthcare provider. But I think the take-home message is you should not fear it, that it's not really associated with any significant adverse effects, and it can really be associated with an improvement in the quality of your life. It can certainly resolve typical menopausal symptoms of hot flashes and night sweats.
And we're seeing that now, you say hormone replacement, it's evolved since it was first introduced. Are there any other new treatments that people should be keeping an eye out for?
There are, because to your point, not everybody can take hormone therapy. For example, a patient with breast cancer. And so those patients will suffer from hot flashes, night sweats, and there's new agents out that can actually block the mechanism by which you have a hot flash. And these drugs are highly effective, almost immediately effective, as a matter of fact, and they can be completely safely prescribed for women who are not candidates for hormone therapy.
Very interesting. Well, it's all wonderful information to have. Thank you so much, Dr. Soper, for joining us today. We really do appreciate it.
You're welcome.
We'll be back after this.